She's a world-renowned celebrity OB/GYN and PCOS expert with clients like Rihanna and Kylie Jenner. And on her podcast, she's educating and empowering women with the necessary tools to advocate for their health.
Dr. Thais Aliabadi, Dr. A, sat down with Sophia Grange for her first postpartum interview where she goes into great detail about dealing with postpartum preeclampsia.
It can happen anytime after 20 weeks. Most commonly, it happens around the time of delivery, but you're at risk for up to 6 weeks postpartum, which is what people don't know.
There's a lot of things people don't know, and Dr. A is here. Welcome. Thank you so much for being here, because you're going to walk us through a lot of these things that people should be aware about, especially women, you know, but we don't know yet a lot about, right? Like PCOS, postpartum preeclampsia. These are all things, I mean, there's enough to worry about when you're pregnant, right?
First of all, thank you for having me. It's so important. When we talk about women's health, the most important thing to realize is that in general, women's symptoms get dismissed in medicine. We have to start there. And what happens is most of our symptoms and pain are brushed off as being, you know, in our head, we're emotional. For that reason, it takes longer for women to get diagnosed. And, you know, they don't get the care they need. So, and that's why I started the SheMD podcast. And it's an all-women's podcast. We basically we bring celebrities, and I'm so grateful for these celebrities with large platforms, because they start talking about their very intimate medical conditions, and they bring awareness to that topic. We've covered endometriosis, PCOS, breast cancer, menopause. I mean, the list goes on. And the reason I started this podcast was to empower women at home to have the knowledge and be educated about their symptoms so they can be their own health advocate. Without that, it's not going to be easy.
Well, speaking of educating people, PCOS, right? For those who don't know what it is, like we didn't. What is it and how common is it?
That's why it's so heartwarming to come here. I want PCOS to be a household name. I want if you know about migraine headaches, you should know about PCOS. PCOS is one of the top causes of infertility in women. We all should know about it, right? And it affects 15% of women, and it's a hormonal imbalance that has devastating symptoms for these patients. Out of those 15% of women who are affected by PCOS, 75% are never diagnosed. And of the ones who are diagnosed, they're not being treated correctly. I always say if men had a condition that was their top cause of infertility and 75% of them would get dismissed, I mean, that would never happen.
There would be some kind of cure or solution. But you are working on a solution, and you have one with you right here. Tell us about that.
So Ovii is my company. Actually, it's launching today. It's my 20-some years of work. It's been my passion in life to bring awareness to PCOS. And Ovii is not just a supplement. It's a science-backed, once-a-day formula that basically addresses the core symptoms of PCOS. And, you know, from hormone balance to sugar support to body composition to cellular health. And it's going to be a game changer for patients who have PCOS. On the website, because 75% of patients are not diagnosed, I actually have a risk assessment test that patients can take. They answer a few questions, and obviously I cannot diagnose them without seeing them, but taking this test will tell them whether they have the likelihood of having PCOS. And if they do, then they will really benefit from this incredible supplement.
So is this something you would do daily? How does that work?
Yes, it's a daily, it's one scoop once a day. With patients can mix it with water or any drink, and we recommend taking it with the heaviest meal of the day. And like any other supplements, it doesn't work over time. You really need to give it 3 to 4 months, but it'll make a huge difference in their symptoms.
Is it essentially like balancing the chemical?
It balances basically their hormones. It supports their blood sugar. It's very anti-inflammatory, because PCOS patients have this low-level chronic inflammation, so it addresses that, and it helps with body composition.
Other than the low-level inflammation you're talking about, what are some of the symptoms? Because I think a lot of women don't know what they're experiencing, and then it goes undiagnosed.
Very good point. So in order to diagnose PCOS, you really don't need to go to a doctor. It's very simple. You need 2 out of 3 of the following criteria. 1 is history of irregular periods. 2 is PCOS-looking ovaries on ultrasound. These are polycystic, doesn't mean you have to have cysts on the ovary. These are little follicles. There's a specific finding on ultrasound. Unfortunately, that gets missed, you know, all the time. And the third criteria is elevated testosterone symptoms or elevated testosterone in the blood. So you don't really need to have a high testosterone in the blood to get the diagnosis, but you can have symptoms of high testosterone. What are those symptoms? Facial hair, body hair, acne, male pattern, hair thinning. Oh. So these are, it's very simple. Majority of these patients have mood disorders. A lot of them, 75% of them gain weight. These are patients who go to the doctor and their doctors tell them, well, eat less and exercise more. And sometimes they come to my office, they're like, how can I possibly eat less and exercise more? It's not possible. A lot of them, actually, as teenagers, end up in psychiatric offices having an eating disorder. Oh, wow. So they treat them for eating disorder where the source of the problem is somewhere else.
Oh my goodness. You're going to have to come back because there's so much more to talk to you about. And before you go, I do want to address this because October is, of course, Breast Cancer Awareness Month. And I want you to speak to how important it is that women starting at 40 start getting screened.
So good point. I actually had breast cancer exactly 5 years ago. Wow. It's not just 40. So just like women know their name, their last name, their phone number, and their social security number, they should know their lifetime risk of breast cancer. That's the most important message I can give today on Breast Cancer Awareness Month, meaning Tyrer-Cuzick is a formula. You can plug in your information, and it tells you what your lifetime risk of breast cancer is. If that lifetime risk is 20% or more, you actually have to start doing your breast imaging as early as 30, 40 is too late. Wow. For patients who fall into the intermediate category, which is 15 to 20%, those patients actually might need to have additional imaging. So depending on the density of the breast, the lifetime risk, there's all, there's different management. For patients who want to know their lifetime risk of breast cancer, actually on SheMD podcast, I have the Tyrer-Cuzick formula. It's free. I put all the information on there. They can just go in, put in their information, figure out their lifetime risk, and depending on that percentage, I have videos explaining to them exactly what they need to do.
Wow. Okay, take advantage for sure of all these resources. Thank you for coming in.
Thank you for having me.
Please come back again. I know you're very busy. And check out PCOS Solution. That is the podcast, right? And also Ovii.com. That's it. Go there. Right.